Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So let's take a look.
Hey everyone, today we're going to talk about Meclison, a medication that combines meclizine and pyridoxine. It's used for nausea, vertigo, and dizziness. Meclizine is an antihistamine, which means it helps prevent and relieve dizziness and nausea. Pyridoxine, also known as vitamin B6, is a super important vitamin for our bodies, and together they make a great team to fight those annoying dizziness and nausea. So what is Meclison used? Well, it's often used for nausea and vomiting during pregnancy, for dizziness you get when you move around a lot, and also for vertigo. For example, if you get motion sickness or have Meniere's disease, this medication can help a lot. How does this dynamic duo work? Meclizine blocks histamine, which is a substance that causes dizziness and nausea, and pyridoxine helps your metabolism work better and produce neurotransmitters, which are chemical messengers used by your brain. As for how to take it, always follow your doctor's instructions. Usually, you start with one pill before traveling or when you feel the first symptoms. And then to continue the treatment, you can take one every 24 hours, but that depends on how severe your symptoms are. Keep in mind that like any medication, it also has side effects. Some people may feel sleepy, have a dry mouth, or have blurry vision. And remember, if you are allergic to meclizine or pyridoxine, don't take Meclison. Lastly, if you suffer from nausea or dizziness, Meclison may be a good option for you. But before you start taking it, talk to your doctor and follow their instructions carefully. Thanks for watching. Don't forget to like and subscribe to the channel for more health tips.
If you've made it this far, let us know in the comments why you're using this medicine.